Good afternoon, and welcome to this webinar in the Humanity and Health webinar series. This webinar series is supported by the College of Arts and Sciences, the Hudson College of Public Health, the Office of the Vice President for Research at the OU Health Sciences Center, the Office for the Vice President for Research and Partnerships at the OU Norman campus, and the OU Arts and Humanities Forum. And it's honor and privilege to welcome you today. I'm Dr. Gary Raskob, Dean of the OU Hudson College of Public Health, and indeed very pleased to be able to moderate this very interesting session that we're having. It's a delight to welcome friend and colleague Dr. Kyle Harper, Professor of Classics and Letters and Provost Emeritus at the University of Oklahoma. Dr. Harper is a historian of the ancient world whose work has spanned economic, environmental, and social history. He's the author of 3 books: Slavery in the Late Roman World, AD 275 to 425, which was awarded the James Henry Breasted Prize by the American Historical Association, and the Outstanding Publication Award from the Classical Association of the Middle, West, and South. His second book, From Shame to Sin, The Christian Transformation of Sexual Morality, in 2013, won the award for excellence in the study of religion in historical studies from the American Academy of Religion. And his third book, The Fate of Rome, Climate, Disease, and the End of an Empire, in 2013, has been translated into 12 languages. And he is currently writing a global history of infectious disease. And it's really timely and wonderful to welcome Professor Harper, whose focus on the role of infectious disease in ancient history is really an intriguing, very interesting area. Professor Harper, welcome. We're delighted to have you to present this webinar today.
Thank you so much, Dean Raskob. It's a pleasure to be here. I'm hoping that my screen sharing is now functional. Are you all looking? Gary, can you give me a thumbs up if you see my PowerPoint slide? Good, okay. It's always reassuring. Thank you everyone for being here and the chance to share some ideas. I apologize for the slightly ridiculous title, but I'm glad to have an interdisciplinary audience. And I'll start like a scholar of the humanities with literature, a great science fiction novel by the great science fiction author Jules Verne. Not his best, not in the same league as Around the World in 80 Days, but a book that if you haven't read and you like science fiction, you might enjoy, known as The Begum's Millions. And it's a great fable of modern times, because the story goes that a rich woman dies, and 2 long lost relatives, unknown to her and unknown to each other, inherit her hundreds of millions of dollars. One of them is French, one of them is German. This is not a book that's very kind to the Germans. And they both take their hundreds of millions and move out to the American West, and each found a utopian city. And the French city, which is called Franceville, is obsessed with public health and hygiene. And the German city, known as Steel City, is obsessed with using science for destructive purposes. And its leader is obsessed with building destructive weapons, a kind of weapon of mass destruction, already in 1879. The leader of the French city is really an embodiment of the public health spirit of late 19th century progressives. You can see here his vision for what a utopian city looks like: to clean ceaselessly, to destroy as soon as they are formed those miasmas which constantly emanate from a human collective, such as the primary job of the central government. And as he so often did, Verne really captured the spirit of the age, also in a way that looked forward. And it really is a visionary, I think, story or fable about the use of science both for destructive ends as well as for life-giving and life-saving ends, public health. But the French city's vision of what the future might look like, one in which humans conquer infectious disease, is nonetheless one that fails to foresee 2 of the unintended consequences. One is that the control of infectious disease has brought with it massive population explosion that has in turn led us into the new geological epoch that we live in, known as the Anthropocene. And secondly, that in a sense, the success of humanity or the multiplication of humanity as a species has paradoxically encouraged the emergence of new infectious diseases. And so that's what I want to really talk about today and outline in 20 minutes to talk about the last century or so of human history in the very big perspective. And it's a period defined by the health transition that is a great transition in the way people die and consequently the way they live that I'll define. Secondly, the globalization of this process, the globalization of good health, of long life, and the unintended and unforeseen population boom that's brought in its wake. And then as a consequence that's inherent in humanity's expansion, the rise of what we've come to call emerging infectious diseases that sets the context for the current pandemic that we're all living through. This is a material that's drawn from chapter 12 of a book in progress that Dean Raskob mentioned. The book is Plagues Upon the Earth. The chapter is called The Disinfected Planet. It is the last and final chapter of a book that tries to practice what people call big history, history on long time scales where you can see processes that you might not see if you zoom in. And I'm a Roman historian and became convinced of the need for this kind of history of infectious disease to be able to understand the health and the disease environments of the Roman Empire in a bigger perspective. It's a perspective in which humans are always part of nature, and the human species is both enabled and constrained by its search for energy, as well as its role as a host to parasites. And infectious disease is fundamentally a host-parasite process. And so when we think about infectious disease, one way to think about it is that humans are an animal host that serves as a source of energy and cellular machinery for microparasites. It's a kind of history that's global by its very nature, transnational, transregional history, and that is environmental. To me, it's also social science history that can draw on new archives. So it's truly interdisciplinary. It's drawing on the great advances in genomics that are giving us new insights into the history of diseases. And it's a history that I hope can contribute to other fields, even as it draws from the history of medicine, economic history, and so on. And in the big picture, one of the main threads of human history is that humans get better at extracting energy, our numbers grow, and this in turn has negative feedbacks, principally in our health, in that it induces the emergence and evolution of novel pathogens that cause infectious disease. So I'll start by outlining what's really one of the fundamental processes that leads to the world that we live in, the health transition, sometimes called the epidemiological transition. And it's a great sea change in the way that human beings die, from causes of infectious origins to causes of chronic organ or neoplastic cancers as the main way in which mortality is experienced within a population. So this is a great shift that happens once in human history down to the 19th and 20th century in different parts of the world. Most people, most of the time, die of infectious diseases. So they die of diseases that are caused by microorganisms, viruses, bacteria, protozoa that cause a disease process in the body. In the late 19th and 20th centuries, this changes, and now most people, even in the shadow of this pandemic, die of cardiovascular disease, of cancer, of diabetes, of neurodegenerative disorders, and so on. So this transition is part and parcel of a bigger process that historians call the demographic transition, which is a shift from high mortality, high fertility societies to low mortality, low fertility societies. And the control of infectious disease is largely the driver of this process. So the decline in fertility always and everywhere follows the decline in mortality. And the decline in mortality caused by the control of infectious disease is itself the root cause of many of the demographic changes of the last century and a half. Before the demographic transition, how did people die? They died of infectious diseases, but more specifically, tuberculosis was the #1 killer. Other respiratory diseases, scarlet fever, diphtheria, whooping cough, and so on, were major causes of death. Fecal oral diseases like typhoid fever, and then a range of diarrheal diseases and dysenteries like shigellosis were among the main killers. Syphilis, the most important sexually transmitted disease before AIDS. Vector-borne diseases like malaria in certain parts of the world. And then typhus, a small, kind of a unique vector-borne disease, as well as smallpox, one of the great pre-modern killers. When did this transition happen? It depends a little bit on where you are. It happened first in Northwestern Europe and the United States, places that had a kind of natural health advantage where there were low burdens of vector-borne diseases like malaria to begin with. It's a process that begins earlier than sometimes is usually recognized. Really, there are important gains as early as the 18th century, but then these are set back. These are stalled in the middle of the 19th century in the midst of rapid industrialization, where rapid urbanization without modern sewage and other kinds of public health infrastructure actually caused a reversal of some of the early progress. But then in the late 19th century, political movements and science galvanize important breakthroughs. But I would emphasize that the importance of some of these earlier gains in controlling the great killers like plague, smallpox, and typhus, as well as keeping cholera in check in some of the precocious Northwestern European and American societies that pioneered the health transition. And the 1870s are really a turning point when, even despite the challenges of industrialization, that sustained increases in life expectancy and declines in mortality began, and they're achieved over the next 6 or 7 decades in Western Europe and the US. Why did this happen? This is a question maybe we can come back to in the Q&A. It's an open question. It's a very interesting one. There are different opinions. Here are the main drivers. The debate's usually about sort of the weight that's assigned to each of these, but one is simply economic development. People have more wealth, they have more food, they're healthier, their bodies are able to withstand the challenges of infection more readily. So, and disease, whether it's tuberculosis or measles, if you're half starving, you're far more susceptible to negative outcomes. And so partly it's just simply economic growth that gives societies more food to eat. But then the main driver is probably science, the understanding of the microbiological causes of infectious disease that allow understanding and then responses to the challenges of infection that lead to better public policy. So public health, both the provision of public goods, particularly clean water, probably the most important public good health resource of all, as well as the coercive powers of the state that grow steadily over the 19th and early 20th century that enforce things like food safety laws, vaccination, mandatory notification, and so on. Of course, we understand the importance of public policy in the midst of the COVID crisis very well. There's also cultural changes around new attitudes towards hygiene and cleanliness, both of the body and of the domestic environment. And then really, in some ways, less important than you might think because they're a little bit late to the game, at least from a Western European and American perspective, are actual biomedical interventions, vaccinations, antibiotics, and insecticides that are very important globally in driving down mortality, but are also important in sort of securing good health, even in places where they don't initially lead to the decline in mortality. And so vaccinations, for instance, with the exception of the smallpox vaccine, the first widely distributed and effective vaccine, most vaccines are more important for holding in place the gains that have been made, even as the population grows, rather than accounting for the initial mortality decline. That doesn't really lessen the significance of vaccines in securing humanity's control over infectious disease. Here's just a representation. The bottom left shows per capita incomes and life expectancies in pre-transitional times. That's by continent. And then you see on top wealth and life expectancy at birth today, or 2017, by country. So you can see that societies have become much wealthier, but also that even at low levels of income, life expectancies have gone up dramatically, largely because of the scientific understanding of infectious disease and the ability to spread technologies of health at a more cost-efficient rate. So here's just one example of one particular infectious disease that's one of the 3 or 4 most important infectious diseases in the 19th century. Typhoid, it's spread by dirty water through fecally contaminated water, and massive urban infrastructure in the late 19th century, and particularly the early 20th century, to filter water in public water supplies, and then particularly the almost miraculous treatment of water with chlorine that spreads extremely fast from the 1910s onward in the United States, and brings the threat of typhoid fever under control. So one of the great killers of the past, the reason why we can drink a glass of water in the United States today and not worry about it, is because the water has been treated with chloramination now, but the same chemical principles. And this really is a fundamental change. And sometime in the early 20th century, what had once been absolutely normal, which is that children die of infectious disease, you can almost expect it, becomes something that's just morally problematic, a tragedy, because it's so preventable once the knowledge. And so here you see a progressive reformer and child rights advocate, Florence Kelly, saying that it really is an accusation against the community with the knowledge and tools that became available to tolerate infectious diseases. Over the course of the 20th century, the health transition, the revolution in life expectancy and control of infectious disease is spread globally. It spreads quickly in the early 20th century in countries that adopt the kind of suite of scientific techniques and technologies to control infectious disease. So Japan, Korea, Jamaica experience really extraordinarily rapid and dramatic improvements in public health in the early 20th century. In the middle of the 20th century, say from the 40s, 50s, and 60s, largely contemporaneous with decolonization, the global majority undergoes the health transition in the space of 4 or 5 decades. And then in the later 20th century, it spreads even in tropical regions where some of the biggest health challenges in the world lay and still lie, such as equatorial Africa. One of the important phenomena is that the countries that start later move faster. So it takes Britain, which is really a pioneer, almost 200 years to control infectious disease, partly because they start out not knowing what causes infectious disease. But as science spread, ideas are free, or what the economists call the non-rivalry of technology. And as knowledge spreads and improves, it means that gains in health can be achieved more quickly. At the same time, the geography of disease still matters. So particularly in equatorial regions that bear a heavier burden of infectious diseases largely because of vector-borne diseases like malaria. The tools that maybe work in Britain are different than those that you might need in a region where malaria is a serious health problem. So the geography of infectious disease still matters. But one consequence of this is a massive population boom. The fertility transition follows the mortality transition by 2 or 3 generations. And so societies that control infectious disease generally are still high fertility societies where the average woman will bear 5, 6 or more children. Cultural changes that decrease the average number of children born per woman unravel over the course of 2 or 3 generations. In consequence, once mortality declines, but before fertility declines, there's a population explosion. As this process is globalized over the 20th century, human numbers explode. And I can't resist a good turn of phrase, and this is a catchy way of putting it, but the human population explosion of the 20th century happens because of the control of infectious disease, because of mortality decline. In other words, because human beings, not because they suddenly started breeding like rabbits, but because they stopped dying like flies. And here you see a representation of human demographic history over the last millennium. At the beginning of the 20th century, there were 1.6 billion humans. A century later, there's nearly 7 billion humans, and we're now careening towards 8 billion on the planet that we inhabit today. So human population explodes in the wake of the control of infectious disease. This is really an acceleration of a much deeper pattern of human expansion over the globe, and a deeper pattern of the emergence of infectious disease that's triggered by human success. And I think it's an acceleration that from the mid 20th century, it gains tremendous momentum. And people start to become aware of it in the 80s, really, in part because of the AIDS crisis. By 1991, the Institute of Medicine issues a report that was co-authored by Nobel laureate Joshua Lederberg, who's a student of microbiological evolution, The report is kind of a milestone. It's titled Emerging Infections, Microbial Threats to Health in the United States, and really realizes that human population growth will continue to drive pathogen evolution and cross-species emergence of new infectious diseases. So this is part of a pattern that accelerates. It's not entirely new, and yet the population explosion speeds up the emergence of new infectious diseases. So I'll give 3 quick examples. We don't always think of these as emerging infectious diseases, but on slightly longer timescales they are, and they have the advantage of being very different kinds of diseases. So I'll start with polio, which is an enterovirus. It's a disease that's transmitted via the fecal-oral route. In many ways, you can think of polio, it's only, poliovirus as we know it is only about 2 centuries old. And it's really a minor disease until about 1900, when it starts to spread. Paradoxically, it spreads in societies that have led the health transition. And here you see in the United States, just as humans sort of gain control over other diseases like typhoid, polio starts to spread. And it spreads terrifyingly in the middle decades of the 20th century and is then eventually brought under control, of course, by the development of not 1, but 2 vaccines that took, in some ways, 2 decades to develop. And so it kind of puts in perspective the acceleration of vaccine development. But polio really is a novel disease that emerges and spreads very successfully in otherwise quite hygienic, quite clean societies with good sanitation systems, and is one of the great threats of the 20th century until it is checked by the development of vaccines. The single greatest disease emergence event of the 20th century, really a kind of the quintessential new disease of the 20th century, is the HIV-1 virus. It's one of 7 or 8 retroviruses that in the family that infect humans. It's largely a sexually transmitted disease. It can be transmitted by blood, so contaminated needles. It emerges as a human disease from having been a disease that infected chimpanzees. And around 1920, this is only known from genetic evidence that dates the emergence of this species crossover event. It spreads quietly for decades in colonial and post-colonial Central Africa, and then it's quietly globalized from the late 60s, but particularly in the 70s, in the age of jet travel, and of course becomes recognized as a public health crisis in 1981, and by then has already spread very significantly in the United States, but particularly in Africa, and decreases life expectancy in large parts of sub-Saharan Africa. So it's just a quintessential example of human encroachment on environments that lead to cross-species disease emergence events that then take advantage of human population growth and transportation to spread. And then finally, coronavirus. So here you see at the top right, SARS-CoV-2. There are actually 7 coronaviruses that are known to infect humans. 4 of them cause the common cold. 2 of them emerged in the late 20th century, the Middle Eastern Respiratory Syndrome virus and SARS-CoV-1, that are relatives of the virus that causes COVID-19. You can see a molecular clock, a genetic dating of the emergence of these viruses. One of them is late medieval and somehow entered the human disease pool in the late Middle Ages, but the rest of them are really modern, and we can think of them as products, unintended byproducts of human population growth. And one of them, OC43, that's one of the 2 most widespread coronaviruses. It causes the common cold. The odds are very good that many of us on this Zoom have had this coronavirus. Emerges from its closest known relative is a bovine coronavirus, and it's probable that the massive expansion of the beef industry in the industrial age creates the environment where a pathogen like this can spread and then eventually cross over to humans. But the point is that the emergence of a new coronavirus doesn't come out of nowhere. It comes from a family of viruses that are widespread in wild animals, particularly bats, but that cross between species with enough regularity that they have at least 7 times become pathogens capable of infecting humans. So I'll close with these thoughts that that the emergence of infectious disease is a kind of historical process that is driven by human expansion that we need long time scales to see. There will be another emergence of major infectious disease in our lifetimes because it happens regularly. Humans are particularly exposed to respiratory viruses because we live in such dense and interconnected populations that we're very attractive hosts for viruses that depend on transmission between the respiratory tracts of humans and viruses in particular, because humans don't have highly effective generic weapons against viruses. Rather, it requires the development of vaccines to respond to the viruses. Emerging respiratory viruses are a category of particular concern as humans not only multiply, but also become more wealthy and more intensely use the planet's resources and encroach on ecosystems. It encourages the emergence of new diseases, our travel that connects us, and then climate change and biological warfare, of course, also major risk factors. So we were in some ways lucky that SARS-CoV-2 is as major a crisis as this is. I'll just close by reminding us that other coronaviruses, SARS-1 and particularly MERS, are even more virulent, and there's no reason why a disease that's transmitted just as efficiently as SARS-CoV-2 but causes an even more severe disease couldn't emerge. So thank you, and I look forward to questions.
Thank you very much for that succinct tour de force review. I think that was really excellent. And so we now have the opportunity for questions and discussion. Please just enter your question into chat, or you can ask your question, I think, if you wish, but we've got a lot of people. So in the Q&A section, if you can enter your question, we can monitor those and have Professor Harper respond. Maybe.
Am I supposed to be able to see them, or are you gonna?
I think, well, I'm watching them. I don't see any yet.
Okay.
I'll let you know. Maybe I can start with a question. Okay, good. Here we have a question. They put it in the chat, so I'll look for that. So yes, please, Eileen, please go ahead. Regarding humans encroaching on animal habitats, what is your question?
If you can see it, Gary, can you just ask me, because I don't know exactly where to find it.
Yeah, no, that's right. So the comment was, I have a question about humans encroaching on animal habitats, but the question wasn't put there yet. So we'll go to the next one. What about the emerging distrust of science? How is that playing a role? And maybe historically, how did that play a role, or did it?
Right. I mean, it's a question that's got to be very much on all of our minds as we kind of reckon with the aftermath of COVID-19, and hopefully, as the vaccine brings it under control, there'll be an opportunity for more serious reflection on how our society could have responded differently and better. And anti-science is nothing new, but it's not always influential enough to affect the course of response to a health crisis. So if you just think about the anti-vaccination movement, which is a quintessentially anti-science movement, its current iteration goes back to has precedence in the early 19th century. So the kind of anti-science that we're living through, on the one hand, isn't new, but obviously there are new media and new channels for the dissemination of bad ideas, of misinformation about say the efficacy of masks. And as a historian, it's not so much the anti-science as the media in which it's transmitted that seems to be the new thing that maybe we'll be able to see with a little hindsight about this pandemic.
You touched on globalization. One of our participants asked, could you address the issue of globalization, of global capitalism in relation to the problem of infectious diseases? How has that continued to influence?
Well, yeah, it's a great question. It's a big question. The hard thing is just how do you answer that sensibly in a kind of concise way. In the book, even in the introduction, I talk about the fact that people use the term globalization very loosely, and it means different things to different people. And I think globalization is a deep process, and we can talk about the globalization of disease already in the Roman period. Now, of course, there's not transatlantic travel, so you're really talking about Europe, Asia, and Africa. But the rise of long distance trade is already in the Iron Age, leading to the circulation of diseases. So one of the deep patterns of human history is that as transportation technologies improve and as economies are more integrated, then pathogens take advantage of this and spread. And so the Columbian Exchange, the crossing of the Atlantic, is one very powerful process of biological exchange that's driven by one chapter in globalization. I think there's really, in the modern period, in the last 2 centuries, there's really two different periods of globalization. The mid-19th century globalization that's driven by steamship and railroads. So for the first time, humans are kind of freed from biomechanical power for transportation. So the fastest you could really move was with a horse, and the fastest a disease could move was as fast as a horse moved. And you can actually track some of the early influenza pandemics. They move exactly as fast as a horse can travel. And that changes when people figure out how to use fossil fuels to power transportation. And so the 19th century is really the period when diseases are spread by steamship, which cholera is spread by steamship and railroad. You can think of the third plague pandemic that spreads in China in the 19th century and then really goes global in the 1890s in the age of steamship. The 1918 flu is really kind of the culmination of that. So globalization drives the integration of peoples, of economies, but also of pathogens. And one phase of that in the modern period is the 19th century, driven by fossil fuel transportation. And then the other, as I alluded to, is the age of jet travel. So the kind of availability of jet transportation to civilians that becomes really widespread in the 1960s is a kind of new epidemiological transition that before that, you had to take a railroad, you had to take a steamship, but the ability to cross a continent in a matter of hours really does accelerate the spread of diseases, particularly these kind of very acute respiratory infections. So the COVID-19 crisis really is, I think, belongs to the age of jet travel. So that's a start to answering that question.
So I think there's another question which I think is related to that or builds on that. I'll read. Is this what you're describing? Is this something like a unified theory of the Anthropocene? Though the dates don't line up, 1870 versus 1945, are you associating the health transition with the Great Acceleration?
Yeah, and the title promises a little more than it delivers, Zev, on in terms of kind of reckoning with the Anthropocene concept. And just I assume there's a lot of familiarity and people on the Zoom who are far more expert, but let me just briefly say that the Anthropocene is the name of a proposed new geological epoch that would be said to begin in the mid 20th century, really with human controlled nuclear explosions that will leave their mark in the stratigraphy of the Earth long after we're gone. It has become a more encompassing idea that has a less technical sense of a planet that's dominated by humans, and so fundamentally that its biogeochemical processes are really, if not controlled, at least inseparable from human resource use. And so in that broader sense of an utterly human-dominated planet in which we can't really think about a natural environment that isn't pervasively influenced by the biological success of one particular species of ape, humans, I think this is part of that kind of broader Anthropocene concept, and really in two ways, Zev. I think one is maybe what you're getting at, that yes, I mean, I think it doesn't make sense to think about what are the causes of the Anthropocene without reckoning with the control of infectious disease, because the success of humans in going from 1 billion to 8 billion is sort of the really basic cause of the expansion of resource use. Now, at the same time, humans also use more energy per capita than we did in the past. But it's really those two very basic facts, that there are now almost 8 billion of us, and that on a per capita basis, we use thousands of times more energy than, say, even hunter-gatherers did, that are putting the pressure on the Earth's biogeochemical processes. So one dimension is, yes, that the proximate cause of the Anthropocene, at least one of the proximate causes, is the controlled infectious disease that causes human numbers to explode. The second is that when we think about the Earth's biosphere, those species do well that can adapt in the evolutionary sense to a human-dominated planet. And that's true of macroorganisms, that organisms that don't do well in a human-dominated planet are going extinct, and we're living through a great extinction. Whereas organisms, and it tends to be a tiny slice of biodiversity, but ones that do well in evolutionary terms, that are pre-adapted to thrive in human-dominated environments, do really well. And so macroorganisms, whether it's rodents like black rats or gray rats, squirrels do very, very well. Humans have been a gift to the squirrel, and they do very well in the kind of environments we create that have acorn-bearing trees and very few natural predators. So humans like subdivisions without coyotes and raccoons and so on, and so squirrels do well. We can think in those exact same terms about microorganisms. Microorganisms that are capable of infecting humans do very well. We're hosts, we're the environment for microorganisms that either adapted to us in the deep past. So think like the tuberculosis bacterium. It's only 5,000 or 6,000 years old, but it's done very well. It's like the squirrel of respiratory bacteria. It's pre-adapted to thrive on a human-dominated planet. And then organisms that maybe aren't old, but are capable with the right genetic adaptations of taking advantage of human hosts, like SARS-CoV-2, do very, very well on a human-dominated planet. So if I were going to reckon a little more with the Anthropocene concept, I'd say that the control of infectious disease is one of the causes of the Anthropocene, and then understanding the ecology of infectious disease in the 21st century really is a question of asking how do organisms survive and thrive on a human-dominated planet.
So related to that, back to our first questioner who asked, maybe how does the encroachment on natural animal habitats affect the emergence of these infectious diseases?
Yeah, I mean, so humans have been doing this for humans have been doing it for 300,000 years. Hominins have been doing it for 2 million years. We're a voracious and versatile species, and we like food, and we are capable of finding it in a broader range of ecosystems than any other animal on the planet. And anytime a predator consumes prey, it is exposed to its microorganisms that infect it. And so humans have been infected with new diseases that are adapted from animal diseases from the very beginning. And as human numbers have increased, and as the size of our cities have increased, and as the transportation networks connecting us have increased, we encroach more on animal habitats that are the source of potential new diseases. And then we create environments where those diseases emerge and survive more efficiently. So again, it's nothing entirely new, but it's accelerated in the last 50 years and in the last 200 years. And I drew attention to the emergence of one of the coronaviruses that causes the common cold, because I think it's very likely a story of industrial agriculture. So it's not just that that humans are cutting down forest, but it's also what do we put there? We put there human created environments that often have very dense aggregations of a very narrow range of species, like cattle, pigs, and chickens, that are a bridge for pathogens to adapt to humans. So many infectious diseases of humans adapt to us from livestock, particularly from chickens, pigs, and cows. And these pathogens in turn came to infect livestock probably from wild animal sources. So, for all we know, the coronavirus, the OC43, probably has a bat host that's even more ancestral, that then adapts to cattle, a kind of an intermediate host, and then ultimately adapt to humans. And that may be the case with SARS-CoV-2 as well. It's closely related to a number of species that are adapted to bats, but there could very well, in fact, there probably is some intermediate host in between the ancestral host and humans. And so, yes, it's about human encroachment on natural habitats, but it's also about the environments that we create largely to produce meat based on a very, very narrow range of preferred species, and the environments that we aggregate those animals in that makes it very easy for pathogens to transmit. So we create these unnatural densities of other animals like cattle. And then I'll just add one final kind of unsettling twist, is that both to control infection, but also to promote growth in livestock, of course, antibiotics are widely used, which creates problems because it is a major way in which bacteria share antibiotic resistance genes and evolve antibiotic resistance genes that make our weapons against bacterial infections less effective.
Kyle, great. Lots and lots of really good questions. I'm trying to respect the order of submission, but at the same time group them thematically a little bit. So the next one I think is very important. How will expected mass migrations due to climate change affect the transmissibility and the ability to control these emerging infections?
Yeah, it's a big question, and I can probably I'm probably safer as a historian trying to think about what kind of perspective on the past tell us about this kind of question, because and I alluded to it on the last slide, although doing this in 20 minutes is very hard. But climate change is one of the kind of wild cards where it's very hard to predict what human change to atmospheric chemistry that will drive change in global climate. It is likely to influence infectious diseases. One of the ways is through affecting the distribution of vectors of infectious disease, namely mosquitoes. But the other way is through human migration, and certainly migration, particularly migration that is forced by resource scarcity, creates environments that are very dangerous for human health. And refugees generally are susceptible to infectious diseases because they're often living in unsanitary conditions, and they're often deprived of basic nutrition. And so it's a recipe for humanitarian disaster. And it creates environments that can spread infectious diseases even beyond migrating populations. So there's a long story. There's a deep history of the relationship between human migration and the spread of diseases that goes back to prehistory. And I think that human caused climate change is likely to be the next chapter in that. And that I think this question's right on, because I think that that migration, subsistence migration caused by climate change is going to be one of the main channels through which climate change affects infectious diseases.
Thank you. How do you envision the humanities engaging programmatically with a theme such as epidemic diseases here, with an eye toward the future when policymakers look to social sciences for advice? Does this apply to other large pressing problems, climate change, vast income inequalities, and so on?
Yeah, I mean, it's a big question, and I'm biased as a scholar of the humanities, and I think even the kind of history that I do that is social science in nature and drawing from the natural sciences is still ultimately humanistic, in that its end is to help us understand ourselves more deeply, and to think of the human story in these terms, in environmental terms, in terms of our health and the way that we have created the health environments and disease environments that we live in, is to practice humanities, even when it may really be just as at home in the social sciences and in conversation with the natural sciences. So I think history is humanistic, even when it's not just sort of cultural history. And I think that we have to have history to understand the world that we've created. I don't think it's possible to understand the human-dominated planet of the last 3 generations without having the backstory. And so I think you have to have a deeper perspective to understand the history of health, to understand the processes of emergence, and you need these longer timescales. The COVID doesn't just happen out of nowhere. It's part of a much deeper set of human-driven changes to the planet. So I think the humanities, the history has to be a part of that. And then a sort of second way to come at that question too is simply to think as a historian living through a pandemic, which has been completely surreal. I think this whole experience has been surreal, and And one of the striking things about it, even for somebody who comes at it as a historian, is how inseparable the questions of behavior and meaning and ideology are. And you can't separate the scientific and technical questions from the questions of human behavior and questions of value. And everything about this pandemic has really reinforced that. The responses to it across societies, within societies, I think underscores the importance of culture, the importance of values, and we can learn from comparing the response to this pandemic to historic pandemics, whether it's the 1918-19, whether influenza, whether it's the 19th century cholera, whether it's even more deeply the rise of smallpox, the bubonic plague. There are massive differences, but I also think you gain perspective when you compare and contrast. And this episode, the COVID-19 crisis, has really underscored the importance of going beyond just technical solutions. And even now that we apparently have a very good technical answer in a vaccine or multiple vaccines, I think you're still going to see the importance of values, the importance of communication. We're not out of the woods. I think it's going to be complicated to get from here to stability again, maybe more complicated than we want to believe, even having lived through the last 9 months of chaos.
So that's a good link to the next question, which is take you back to your introductory slide on Verne's novel and the cautionary tale of Begum's Millions. So if we leave aside for the moment the anti-vaccine movement, the anti-masking, the social distancing, the anti-movements to those things, does Verne's cautionary tale hold lessons for us? Or another way, is there a danger of over-sanitizing our pathway forward and leaving us resistant to new pandemic diseases?
Yeah, I mean, what a great question. And I think the meaning that Verne intends is something like the claim that science or our expanding knowledge of the natural world is a kind of power, and it can be used for good or bad ends. And as somewhat cartoonish as the French and German characters are in this, they kind of are meant to be cartoonish symbols of the good and bad use of science. And leaving aside, it's pretty obvious that the dystopian German city where they're developing weapons of mass destruction are unattractive. But I think to read it, maybe I'm not sure this is entirely what Verne means, but there's something a little unsettling, creepy about the city of hygiene. And I'll say Verne was not drawing, it's imaginative, but it's not unrealistic. And the language that he uses to create the city of hygiene is drawn almost verbatim from very contemporary British public health reformers. So there's a famous lecture given by sanitarian reformer named Benjamin Ward Richardson called Hygeia, the city of hygiene. And it's probably the basis for Verne's imaginary city. And you just think, my gosh, these people spend all their time cleaning and so obsessed with their health that they don't have any time for living. But in a way, we've come to live very much in that society, in that world. Our daily routines, from personal hygiene to the water we drink, the food we eat, it's easy for us to forget the pervasive ways in which the world we inhabit is one that's been systematically disinfected. And so I think the novel is great, and it's a chance just to reflect on what does it mean to live in that kind of world, one where we've created an environment that systematically tries to exterminate the species that do us harm. And it sort of helps us see ourselves and our daily lives, daily routines, even a little more clearly, because it is something that's historical. Humans have not always lived like this. We live very clean, very sanitary lives. And then as the question was getting at as well, it helps us think about the unintended consequences, because it's it makes sense that humans have tried systematically to control infectious disease. It reduces suffering and death. And these killers of the past were caused immeasurable and excruciating pain and anguish. And it only makes sense that we've tried to eliminate smallpox, which we did, but also reduce the burden of tuberculosis and scarlet fever and typhoid. But I think it helps to remember that these are other organisms that live on the planet, and in many ways they exist because we exist. And the story of humanity's expansion is the reason why these organisms evolved. And what that reminds us is that there will always be new threats. And even if we control the infectious diseases that threaten us today, tomorrow there will be a new one, whether it's coronavirus, whether it's influenza, or whether it's some as yet unforeseen threat to human health. Because we share the planet with so many other species, there will always be evolution, and there will always be new threats to human health.
Not to mention if one of these diseases that we've eradicated comes back. So if smallpox were to be introduced into US population now, that would be devastating, because we've gone generations with no exposures, right? So a question here, I hope our person has been waiting, but I think, do you have thoughts on the problem of the long COVID? Is SARS-CoV-2 just an acute infection, or will it create long-term disability or chronic illness in a subset of the population? And maybe there's a historical parallel, I'm adding this, maybe a historical parallel to polio.
Yeah, I mean, that is a good parallel. And I'm not the right person to answer that. Somebody who has deeper clinical virology would be better suited. But it is, as a citizen, it's an important question. As a student of infectious disease, it's a very interesting one. This does seem to be really a pretty nefarious virus that there's something about it that the vascular involvement causes a range of very tricky and severe complications. And with the number of clinical cases that there have been, I think it's not surprising that there are large number of strange complications. But it does seem to have a kind of virulence that's not characteristic of say the coronaviruses that cause the common cold, that don't have pretty severe vascular involvement that lead to these cardiac issues that we're seeing, to the long-term struggle of many patients to return to full health. So the Dean Raskob mentioned polio. It's a very good example, because even apparently full recovery from polio can wear off after 3, 4, 5 decades, and lead to neurological complications later in life. So viruses are tricky, and it's one of the reasons why, in kind of the public health calculus of addressing these challenges where there really are trade-offs. There really are, of course, very complex trade-offs in policy decisions that are made. But it's the element of the unknown that I think is often lost. And one of the really potentially important ones is that even beyond the kind of immediate costs of health and loss of life, there are these unknowns that are potentially relevant, that are very hard for us to wrap our minds around as we make political decisions about trade-offs between health and business and commerce in the short term. So it's an interesting question, something that I'll be following with a lot of interest, and won't be surprised if it really does end up that some of these long haulers and the long haul issues end up being really important.
We're right at 1 o'clock. Maybe we can close with one last question briefly here. And I think it's interesting. So given the Anthropocene is defined by human, impact on the planet, how might common school education K through 12 be changed such that today's children become adults who are better prepared to understand the complexity of their effect on the planet? Or public health, we talk about the One Health concept, right?
Right. Yeah. That's a great question for many of our colleagues in education. I think obviously we want to be graduating students that are prepared for citizenship and life in a world where they have a voice and they have a responsibility, and they have the equipment to contribute and to function in a world where their voice, their vote matters, and they have the literacy to understand that they're making choices that affect themselves as well as future generations. I think we do a lot already to help prepare very young kiddos to come into a world where they realize they're going to inherit some very serious challenges, and I think we just have to help them continue to understand that. I think it'll be important to include health, as you say, the One Health, the idea that human health is connected to animal health and to planetary health as part of that. And I'm sure that that COVID will get worked into curricula at all levels. And I think that's important because, as I close by saying, and I'll say again, this was it couldn't have been predicted precisely, but it was completely predictable that there would be a public health crisis driven by an emerging infectious disease in our lifetimes. And it's completely predictable that there'll be another one, and it could be worse. And so hopefully we can learn from this one what worked, what kinds of political strategies and educational strategies we need to be better in the next one. And that will take people who understand history, people who are experts in human behavior, people who are experts in communication and education, working with public health experts. It'll be a collaborative enterprise, and universities can, I think, play an important role. So thanks for the chance to share these ideas.
Thank you so much. I know there are a number of other, actually quite a lot of remaining questions, so we'll apologize to our colleagues. There have been some great comments, and I know the audience shares with me in our sincerest thanks and appreciation for a terrific seminar and a terrific discussion. Thank you.
Thank you all.